You are listening to the 79 West podcast series, recorded in Pittsboro, North Carolina. We hope you enjoy.
My name is Mike Desai. I am the CEO and co-founder of Truentity Health.
Wonderful. And for those of you who don't know, I'm Jenna Dunning. I'm going to be hosting this podcast today. Mike, I'm so excited to have you here. Truentity is one of our newer tenants. I believe you guys came in January?
January, yeah.
January.
Yeah,
that's awesome.
6 months almost.
That's great.
Yeah.
So, my first question, can you tell us about Truentity? What do you guys do?
Sure. So what we do is we work with independent pharmacies nationwide and basically turn them into what we call clinical hubs. Okay. So today, a lot of people think about pharmacies as retail, and that's where they go to pick up their prescriptions, and that's it.
Right.
But there's a lot more things that pharmacies can do, like provide services, clinical services, for their patients, especially the aging population.
Okay.
But under the rules of medicine, they are not recognized as doctors or providers, so they can't bill for those services. And so what we do is we essentially have developed a platform that allows them to provide clinical services to the patients who need it the most, like folks living in rural areas, folks that have hypertension, type 2 diabetes, heart failure, all those conditions where they need the care, but they may be too far away from a hospital. They may be 45 minutes from a hospital, so they skip checkups. If they skip checkups, what happens? Well, their conditions get worse, and they end up, unfortunately, in the hospital. And a lot of these folks live alone. And so what we do is they visit a pharmacy all the time. They visit their pharmacies once a month, maybe twice, 3 times a month. And so what we do is that community resource that they visit almost on a weekly basis, we enable those pharmacies to provide clinical services so that the patients can receive the care that they have, that they need.
Yeah. Well, that's very interesting. My mom she was a pharmacist for over 20 years.
Oh,
so,
yeah. Didn't know that. Okay.
There you go. I'm making my connections.
Yeah.
Where you are.
That's amazing.
Yeah. So she worked at a pharmacy in Harris Teeter for the most part. I think she worked at CVS or maybe a Walgreens in her early career, but Harris Teeter as long as I could remember. Yeah. And a lot of her job and like what she always has stories, right? When you work in the medical field, there's stories. Yeah. So whatever I heard, and like it wasn't always a lot, but it was most of her job sounded like giving advice. It wasn't really like, oh, this is the medicine you need to take, this is how much you should take, and you can't do this, this, and this while you take it. There was that, obviously. Yeah. But the majority really was like, how are you feeling? Why have you talked to your doctor, and then her innately giving some advice where she felt she was able to.
And think about it, your mom and other pharmacists, they go to school for 4, 6, they're essentially, they have a doctorate degree nowadays, right? Yeah. But they're tied to basically, what kind of the rules that are set, which is you can dispense medication and you can talk to folks about medication, but you can't provide any additional clinical services, which is, we think our thesis is that that's under leveraging the most available and widely, accessible resource. We found that out during COVID, right? Where did people go during COVID? They went to their local pharmacy because their doctors were too busy. Right. And so COVID allowed, I think, some folks in the industry to realize the value that they bring, but unfortunately, these pharmacies still cannot, or they're not recognized as providers, and they don't have the technology platform to kind of, provide these services.
Interesting. Yeah. So that just kind of makes me think a little bit more about the fact that, like, when she would come home and she was able to get flu shots right at the pharmacy. You think about it, like even vaccines at this point, like these things that you might think, oh, I need to go to the doctor for, they're doing them right at the pharmacy. Like she would bring them home and we'd open the fridge and see flu shots in the fridge. And it was always like, oh, But it is interesting how much these pharmacists do for the population and how often you see them. Like I know she had like borderline personal relationships with people. And again, like HIP is a huge thing and she's not a licensed MD, correct? So she could only say and do so much constantly. And that was like a big issue she had. She's like, I'm helping as best I can, but like I know I could do more and red tape's getting in the way, And on top of that, these pharmacists have wild hours. Their hours
They
are
do,
intense, and it's all on their feet. So to be able to, give pharmacists the opportunity to do a little bit more with a company like Truentity, I think is going to be
Yeah.
highly sought after.
No, and thank you. And again, I think you said a lot of things there.
Sorry.
And no, that's good, because I think you're kind of getting to the core, the root of the problem. Is today pharmacies, aka the pharmacists that are in that pharmacy, they do so much work,
Yeah.
right? They probably, out of all the work that they do, they get paid for about 25-50% of it,
Yeah.
right? Because when they come in and they spend 10 minutes with a patient, reviewing the discharge paperwork and talk to them about their medication that they should take, the new medication, all of that.
Yeah.
They can spend 10 minutes on that patient, maybe multiply that by 10 other patients that walk in that door. All of that time is being spent by the pharmacist. They don't get paid for it, right? Those are all the clinical services that the patient needs, because if the patient doesn't clearly understand what medication they're supposed to take after being discharged, that could end up the patient could end up in a really bad situation,
Sure,
right?
yeah.
But the
Yeah.
pharmacist is the one that's reviewing that, but yet they don't get paid for it. So what we do is we allow pharmacies now to provide these clinical services to these patients who need it, and then once they go under the care and slash of the medical group, our medical group, and the pharmacies now can get paid for that consultation, that interaction,
Yeah.
which helps pharmacies, because today independent pharmacies especially are struggling.
Yeah.
Right? They make most of their money on dispensing medications. They get 5% gross margin, which is not a lot. Versus clinical services, they can provide that's much, much, much higher in terms of dollars that they can make. So this is like new stream of revenue that they're making, but at the same time, they're helping those patients get the care they need.
Yeah. And that's, you brought up diabetes earlier too.
Yeah.
My like childhood best friend, he's type 1.
Uh-huh.
So, I actually, he and I were roommates together for a little while during college. And at some point, he like brought me to the pharmacy. Like we were just running errands and he had to pick up his insulin and stuff. And it's just interesting watching him interact with the pharmacist, because he went to UNC Chapel Hill. It was COVID year, yada, yada. We were staying in Chapel Hill. But like, he's like, oh, how you doing? Is like seeing somebody at a coffee shop.
Yeah.
It's true. Like when those people who have these chronic illnesses and diseases, who have been going to the same pharmacy for their entirety of their adolescent adult life, you really do get to know the person you're seeing on a monthly, weekly, whatever it is basis. So,
absolutely. And if you think about it, Jenna, right? You see a doctor or a person who, a senior living in a rural area sees their doctor maybe twice a year,
right,
3 times a year. They see their pharmacist several times a month,
right.
And every, I've been to so many different towns in North Carolina because we have customers all over the place. And I've personally interacted with so many pharmacists that are 3rd, 4th generation pharmacists.
Wow.
Right? I've been to a pharmacy in Scotland Neck where that pharmacy, I think, has been around since 1902.
Yeah.
He still has the original tiles on the floor, which is kind of just surreal. And then see this 4th generation pharmacist there, who's definitely a lot more business savvy than most pharmacies.
Sure.
Pharmacists that run pharmacies. But it's just amazing to see that, that dedication these folks have, to the profession.
Yeah.
It's like, I don't know, do you know a show called Cheers?
Yes.
Where everybody knows your
Where
name.
everybody knows your name.
I always think of that where, I've been to so
Mhm.
many pharmacies, I'm sitting there, and all of a sudden they know their pets' names, they know their grandkids' names.
Absolutely.
They call their, sometimes they'll even, I was at a pharmacy last week, it was their go live day, and a patient comes in short of breath. Pharmacist takes care of that patient. At the end of that interaction, she drove the patient home.
Yeah.
She drove the patient home, which is something you don't see, right?
No.
Then you're not going to see that.
Yeah.
So the passion is there.
It's absolutely is. And like, it's nice to hear that in other cases too, because, like, I know my mom's always been just like the most caring person I know.
Yeah.
And we always asked her, like, why are you still doing pharmacy? Like, it's so, like, you get home and you could see, like, when she has those days off, like, she really is so exhausted. She should wake up the next morning at 6 a.m., put on the same white coat, you know,
Yeah.
go in. And when she finally retired, she actually, it was right after COVID, and she had finally just, you know, she was like, I gotta be done.
Yeah.
But she had a really hard time because of how rewarding it was. And she told me, like, a conversation, she was like, you know, she's like, I know I should be grateful and, like, be okay with what I've accomplished, but, like, I feel like it was, like, my purpose, you know, to help these people. And, like, this whole time, you know, I'm thinking she's just giving people medication. She's just like, okay, take this, 24 hours, you know, blah, blah, blah. This will get rid of your spider bite, right? Like, and it's just so much more.
Yeah, they have the trust. They have the trust, and that trust has been established over generations.
Yeah.
Right?
Absolutely.
Which is pretty amazing. And that the story I shared with you about that patient who came in with shorter breath, she didn't go to the doctor.
No.
She didn't call 911. She literally, I was sitting there, she literally walked into the pharmacy and went to the pharmacy and said, look at my leg, it's swollen. She's, you know, she had issues with her legs.
Yeah.
And she was short of breath and all of this. She went to her pharmacy, which was pretty amazing to see.
It is. It totally is. And, like, we're going to kind of wrap back around. You were talking about, like, rural areas. And I'm thinking about, you know, before we started this, we were talking about Pittsburgh.
Yeah.
And how it's grown so much. Like, if you weren't, you know, born here, you would have no idea that this was just the circle. Like, literally 5 years ago, that was all that was here. So our primary care was in Cary. And, I mean, that's about 40 minutes away from Moncure.
Yeah.
So if something happened, our first stop would be the Walgreens, truthfully. There was no urgent care here.
Yeah.
It was either you're going to Chapel Hill to the hospital, like UNC Hospital, or you're going to your primary care, urgent care in Cary, Apex, Raleigh, whatever it is. There was no in between. So no matter what, you were traveling at least 30 minutes. And sometimes you don't have that time, you know.
That's right.
I remember when I was younger, I got stung by a wasp on like right where the bridge of my nose is. And I have like a very slight allergic or allergy, I guess, to any insect stings or bites, and my eyes got swollen shut.
Oh my gosh.
And I woke up like the next morning in the middle of the night, and I couldn't see it. I was like trying to like just like wake up. My mom must have been like 13 at that point.
Yeah.
And you know, she was a pharmacist at the time. She had work, so she had to go in. But with her knowledge, she was able to treat me as best she could. And then my grandparents who live in Apex, you know, she dropped me with them. But it was like I had to wait until noon to go see a doctor so I could see out of my eyes. I was, you know, essentially blind for half the day because we didn't have a doctor nearby.
Yeah.
You know, and like luckily home remedies and like over-the-counter medication were able to get the swelling down a little bit. But like I think about that was such like a more of an inconvenience than a pain, right? But you think about the people who are in pain, who do need that immediate care. That's scary.
It's scary, and what you're highlighting is, you know, a key factor, which is the trust that you know, obviously your mom was a pharmacist, but a lot of folks do that. They go to their pharmacist first because they have that, you know, relationship. They keep going at it. And what I think the profession is evolving. Now, you know, a lot of pharmacies are now also offering what's called test and treat. So you can go in there, if you have an upper respiratory issue, you can go in there and get checked up, and you can do a telehealth with a provider, which we will be doing soon.
Cool.
And then once you get diagnosed, maybe you can, you know, the patient can request that the prescription goes right to that pharmacy. So, and it's really good because if you think about the issues we have with the healthcare system today, hospitals are shutting down, doctors are overworked, there's only a certain amount of doctors that are in the field, right? And so you have to wait sometimes, you know, till noon or sometimes weeks for an appointment. Well, by enabling this community resource that everyone visits on a weekly or sometimes, you know, monthly basis, enabling them to do a lot more, that's going to solve a lot of, you know, strain on the healthcare system. And that's, we see that trend happening. It's not happening fast enough, but it's definitely happening. And that's our goal and vision.
So I don't know if you've seen this commercial yet, but whenever I'm watching, like, I watched a reality TV show called Love Island.
Okay.
I don't know if you've heard of it, but it's like all the rage right
now. My
now.
daughter watches that.
Yes. And like no matter what, during one of the commercial breaks during that episode, they play this commercial of somebody who's like at a rave or they're traveling and they get sick or they got like a tattoo and it's infected and they get on a telehealth in like a Porta-John.
Yeah.
And they literally are like talking to their provider,
Yeah.
you know, in this commercial. But the person that they actually see in person is the pharmacist.
Right.
They're just talking over the phone with the provider. So to be able to make it all one interaction instead of having to do this, and then go, it really does make the process bearable.
Exactly.
You know?
And think about
it just makes me think about that. Yeah.
And also, if you're a busy mom or a dad who who's taking kids to soccer or whatever that's going on, you don't have time to call a doctor, go to the doctor's office, wait in the lobby for an hour, then seen, and there's like, okay, here's a prescription, drive to the pharmacy. Imagine a world where you go to the pharmacy, you pull into a drive-through, pharmacist comes out with a tablet, you talk to a provider, and you get diagnosed, and then they say, hey, do you request that the prescription gets sent to the same pharmacy? You wait there 10 minutes, you got kids in the back, whatever it is, and then you go on your way. Think about the efficiency, right?
Yeah, you'd save, and then on top of that, you save yourself from exposure too. Like if you go into a doctor's office, like Timmy's over here like sniffling, and he's got a sore throat, and then you don't know if you're leaving with that same sore throat because he didn't cover his mouth, right?
That's a great point, and that's why doctors actually like pharmacies doing that, because they don't want the sick in their lobby.
No.
And pharmacies, unfortunately, they do see a lot of sick patients, but with drive-through and all of that, a lot of folks can just sit in the car as well.
Right, and then
So,
you're outside.
exactly.
There's less chance of exposure. Totally.
Yeah.
Well, I have all these questions, and I think I asked you, can you introduce yourself? But I was gonna say we're close to the end of our time here, but I guess I'm gonna hit you with probably my favorite question.
Sure.
And it's do you have any war stories from your time as an entrepreneur or small business owner, whatever that is? Was there ever a time where you were like, oh, what have I got myself into?
About like half an hour ago.
So it's just reoccurring.
Yeah, it's always reoccurring, right? It's
Right.
There's always war stories. There's always things that need to get done, and your checklist and all that. There's without getting into so my background is I've been in I've been living the startup life for over 2 decades. I've worked for a bunch of different startups until I started my own back in 2020 during COVID, when the world was shut down.
Yep.
Perfect time to launch a company.
Great.
But there's definitely been war stories where everything from, oh my gosh, we only have 2 months of runway and we're about to shut down, to being stressed about finding the right investors or finding that right customer, issues with product.
Sure.
There's always war stories, but I think there's nothing like entrepreneurship, and having done this for such a long time, there's nothing like building, but then building with a purpose, and then going to these pharmacies and seeing the patients come in for their sit down with the pharmacy, talking to the doctor, walking out with their device and saying, that's the first time I've spent this much time talking to somebody about my medical history. That satisfaction. Then we get stories all the time. I have a spreadsheet of all the stories that are shared by our customers on how we have impacted through our technology and through our workflow and our process lives of patients, how we've kept people out of the hospital, how we have actually literally saved a life of a patient 2 weeks ago.
Wow.
Based on the data that we received, and the pharmacy was able to take real-time action. If we didn't have that data coming in, that patient living not too far from here could have just been living, she lives alone, who knows what could have happened.
Right, absolutely.
Right?
You really don't.
Yeah. So
Wow.
you asked me about war stories, but there's war stories, but
And
there's
there's
also the
success.
really good stories
Absolutely.
that keeps us going and makes those war stories okay.
Well, I'm glad you added that little twist.
Yeah.
That's so nice. Yeah. Well, thank you for
Yeah.
sitting down with me, and thank you for doing what you do, because I think people like my mom would appreciate to know that there's going to be a new route for
Yeah.
this. So anything you want to add? Do you have anything you want to plug? A website, social medias, or are you just content?
No, you can find us on on the web and LinkedIn, and I also want to say about 79 West. We love this place.
Oh, wonderful.
You didn't ask me the question,
Yes.
but I will tell you.
Thank you.
I sent Katie an email the other day about, I think you guys sent that, how we can leverage other spaces and stuff.
Yeah.
And I said, I've been to a lot of spaces. I've been to WeWork and all of those places.
Uh-huh.
And I think our place is the best because it's inviting. It's
Good.
folks like you. And I will also say that my co-founder, who lives in Boston, who goes to WeWork quite a bit, he's been here several times, and he's like, "You guys have the best space." He's like, "I don't like these WeWorks."
Wow.
So,
okay.
yeah,
well, thank you so much.
yeah,
Oh, that's great. That's really good to hear. We really do want to, like, it's about y'all. We want to make sure the workspace is comfortable. If you have to be at work, we want to make sure it's as works as seamlessly as possible. And I think, like, our, like, slogan sort of, like, let home be home. And we really do want y'all to just, like, let home be home and, like, shut off. But, obviously it can't be a total luxury for everybody, but we're glad that you can at least find some.
Perfect. So I'll walk around without my shoes on.
Perfect. Yeah.
Make myself
Exactly. Mess up your hair.
Yeah,
just, like, lay out on one of the couches. Yeah.
Exactly.
All right. Well, thank you so much.
Yeah. Thank you, and thanks for having me. All right.
Thanks for listening. We encourage you to follow us at 79 West Hub to learn more about our space, our tenants, and our story.